Welcome everyone. I'm Councillor Matthew Willington, Cabinet Member for Health, Wellbeing and Social Care. Just some housekeeping about the fire alarm. If it sounds, please evacuate the room and public gallery. There is no one in the public gallery. By the stairwells, do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. No one would have signed in, I don't think, at the reception desk. There's no members of the press or public, so I won't put that. Just please can everyone use the microphones and remember to switch them off when they have finished. Just do some instructions. Anna?
Anna Martin, Democratic Services.
Councillor Lewis Gosling, the Conservative rep on this.
Alison Lawrence, Portsmouth Safeguarding Adults Board Manager.
Andy Biddle, Director of Adult Social Care, Portsmouth City Council.
Thank you very much, everyone. We don't have any deputations today. Apologies for absence. We have apologies from Councillor Brian Madgwick and from Joe York, Managing Director, Health and Care, Portsmouth. Lewis, any declarations of interest? Thank you, and neither do I. So, swiftly on to Alison with the Annual Safeguarding Report, Strategic Plan and Peer Review. Over to you.
Thank you very much. So the purpose of this report is to update the Cabinet Member and the spokespeople on 3 of the Safeguarding Adults Board's statutory functions. Section 5 of the report sets out the achievements of the board in 2021-22 in our annual report, and the highlights include the publication of 2 Safeguarding Adults reviews and update on the delivery of our multi-agency training and audit programmes. Our annual report is included in the appendix, but we also have an easy read version and a 1-page summary on our website. Section 6 sets out our strategic priorities in our plan for 2022-23 and gives an update on our progress. A particular highlight was the conference that we held in September, which was a catalyst for interprofessional discussion, and it also gave us the opportunity to hear from some people with lived experience. We're currently working on refreshing our strategy. Section 7 of the report provides some information about the recent Adult Safeguarding Peer Review, which was led for us by South East ADAS. The purpose of the review was to give assurance on how well the safeguarding system's working in the city. It looked at both the board's functions and the safeguarding services delivered by Portsmouth City Council. The peer review, we're pleased to see, identified some really good practice in safeguarding in Portsmouth, and particularly the reviewers noted the passion for Portsmouth that they came across with everyone they talked to, and the quality of leadership, and there was some really robust and person-centred practice in adult social care. A number of areas for us to work on, which the report identifies, and I don't think these came as a surprise to us as a system. And the 2 major areas I think we'll be taking forward around involving people with lived experience more in our work and their families and carers in a wider cross-section of the community. And secondly, about how we measure impact and change from the work that we do, particularly our safeguarding adult reviews. We're currently working on the response to our findings, and the peer review findings will be factored in when we review our strategic plan.
Thank you very much, Alison. Lewis, any comments or questions?
Just to say, so reading through it was really good to see you've got a couple of lived experience examples in there, and certainly it's really good to see that they're going to form more of a impact because they really do shape the services we offer, but it all looks really good.
Thank you. I think that is a real area we're keen to focus on in our strategy going forward.
I'd just like to thank you, Alison, and David, obviously as the chair of the board, and the rest of your team as well for the work you've done. It's a really comprehensive report, and obviously we've got the annual report attached, and also looking forward about the strategic priorities, which all seem really sensible and good, and I think it really does reflect, as we've had at the Health and Wellbeing Board as well, obviously about this going forwards. Personally, I was at the Safeguarding Conference, which I think went really, really well. It was an absolutely ram-packed room, and so many different kinds of areas of safeguarding, and some really, really good stories of lived experience there, which I think was outstanding. And it was, and I know, speaking to colleagues, both my own workplace and people I work with, both as cabinet member and in my day job, I think it was so well received, and people got an awful lot out of it. And also about the peer review, I think was really worthwhile. Again, I took part in that with Andy and others from the council, and I think it was just a really good way of us expressing in an honest and open way, and the report I came back I thought was very fair, and really did give us a way to move forward on our challenges. So thank you so much for that, Alison, and again, please pass on our thanks again to David and the rest of the team. And I think from our point of view as administration and as a council as a whole, as Lewis has alluded to as well, really making sure safeguarding is everyone's business, whether you're a council employee or a councillor. I think it really is quite critical for us as an organisation to put things first. And just in time, Yinka's arrived, so I'll let her introduce herself, and then if she wants to say anything on this report, I'll let you get settled first. Okay, Yinka, do you want to introduce yourself, and did you have anything on the safeguarding report? Yeah. Well, what I might say, Yinka, is if there's a bit before the end of the meeting, if you want to do anything, and obviously I'm sure you can talk to Alison afterwards. But yeah, do you want to introduce yourself anyway, and then we'll do the second report, and then if you want to come back on this one, I'll say. So,
yes.
yeah.
My name is Yinka Ateniono, Councillor for Charles Dickens Ward, Labour Opposition Spokesperson for Health, Wellbeing and Social Care. Thank you.
Thanks, Yinka. Okay, Andy, so I'm very happy to note that report. As I say, if Yinka has anything, she might come back to you in a minute, Alison. So, but otherwise, anything that comes up, please feel free to speak to us afterwards, or Alison, or whoever you want to, Yinka. So, Andy, on to you for item 4, Portsmouth Health and Care Discharge to Assess Model.
Thank you, Chair. So the report before you, quite a short report, reflecting really that we come back to this forum on quite a regular basis to reflect the work that we do as part of the Portsmouth and South East Hampshire system based around the Acute Trust, because a lot of our residents make use of that service. We have a lot of work shared between ourselves and the other NHS organisations that support the Acute Trust. And we've had a couple of announcements lately of government funding around discharge, and so bringing an update really around that. So the purpose of the report is to update you on the work we're doing within Portsmouth and South East Hampshire, within the local delivery system. And we saw an announcement, the announcement I think was in September, of around 500 million nationally, to support people leaving hospital in a more timely way. And that money started to flow through round about December time. So a bit of a gap between the announcement and the money coming through. So under Section 3 the information requested, it sets out how that fund has been allocated. All of the money will theoretically be spent through the Better Care Fund, which, as you know, is a fund that's shared between local authorities and the NHS to be spent on services for local people in pursuit of the aims of health and care organisations. The tranches that will come down will be 40% to the in December, and the second 60% by the end of, well, by today actually, 31st of January. So theoretically the second 60% is with us, but I haven't checked on that yet. So the allocation's slightly different. In terms of Hampshire and Isle of Wight ICB, the allocation was about 12.4 million across the whole of Hampshire Isle of Wight. For the City Council, our allocation was 742,000. On the bottom of that first page under section 3 and moving over into the second page, there's sort of a broad aim for what the fund is to be used for. Essentially to enable people to leave hospital when they're ready with the right care and support in place. We also have something called a RAP, or Remedial Action Plan, in Hampshire Isle of Wight ICB and in Portsmouth South East Hampshire, acknowledging that we've had some issues with ambulances being held at QA Hospital since around about October 2021. And so the funding is in pursuit of achieving the aims in that remedial action plan. So on the table on the second page there, we've laid out the schemes that we're allocating the 742, which was the City Council's allocation to. Essentially anything that will enable us to safely discharge people from hospital in a more timely way when they're medically fit or medically optimised for discharge. It's mainly around carrying out assessments outside the acute hospital. You recall the guidance that came out during COVID and subsequently was to discharge people with a proportionate support package where they needed it, and then to do an assessment thereafter rather than to make the assessment in hospital, and by that way to try and speed up the discharge process. So all of those schemes there are either for additional purchased capacity or additional resource for assessment to help people move on more quickly. As we've seen recently, there's a risk, or we've seen in the national press recently commented upon, there's a risk of people, if they move into care home accommodation from hospital, getting stuck there. And so our additional assessment resource aims to help them not get stuck there and to move on to where they need to be. Because the vast majority of people coming out of hospital won't need to be in a care home. They'll need to get home, back home, and start to recover their abilities, and maybe with a small package of support. So hence the emphasis on assessment in that money that's spent. I've commented at the bottom of the second page around, we've had a plan for a little while to use the top floor of Shearwater in extremis, so if we needed to create surge beds as part of our action plan. That was considered at the time, but we didn't take that forward because we didn't have a clear demand for all of those beds. And we then had the closure of East Cosham House, for which we used some of those beds, which you'll recall was around about November, December time. We've also, with our ICB colleagues, funded some additional nursing home beds within Mary Rose Manor as part of this plan, and that's going to be funded through the ICB allocation. As we were drafting the report, we saw a further 200 million announced. I think that was round about the 8th of January this year, which was specifically for the ICB to purchase care home beds. It was quite a narrowly interpreted fund. So it's still a bit of an evolving picture. There's planning has been worked up across Hampshire and Isle of Wight ICB. There is a daily monitoring of that plan requested by Department of Health and Social Care. And we're again in discussion around whether we can use some of that facility on the top floor of Shearwater. That's because for those residents who were at East Cosham House that temporarily used Shearwater, they've either moved on or they will move into permanent accommodation at Shearwater. So that capacity is available again. The complication with that is that the 200 million fund is only applicable until the 31st of March, and it's only applicable for the first 4 weeks of someone's discharge, after someone's discharge. And so we can't really take anyone in to Shearwater if that becomes destination. 4 weeks after the 31st of March, we'll have to stop admitting ahead of time. So it's likely that we may see about 6 weeks use of that. We're aiming to stand up some partial beds from next Monday is the plan currently. But it's very much an evolving plan. It's very much responding to the pressures and risks within the acute hospital trust. And so we can bring another update back here, probably at the end of spring into summer, to look back on any other pots that have been created and tell you how we've used them. And that's the report, but of course happy to take any questions.
Thanks, Andy. Colleagues, any questions or queries? Lewis.
Just a few from me, and I think you're right, there's been so many pots of money thrown at this, and yesterday I see there was even more money being thrown at it over the next 2 years, so hopefully at least we'll be able to plan next winter earlier than at the start of winter, so to speak. So it'll be good to see something in the spring to almost evaluate what we've done this year in terms of this worked really well, let's increase the capacity of this, we didn't need this, so let's try and focus on areas of good. But I think it's been, talking to colleagues from around the country, it definitely seems to be something that we're leading the way on, and I think having where we're so lucky in Portsmouth to have already had that joined up working pre-pandemic, it's not something that's news to us. We are used to working hand in glove with our NHS partners, whereas so many local authorities aren't. So actually all of that previous work has stood us in such good step for, and it shows with the difference in the acute hospital of how quickly Portsmouth patients get out versus how quickly a Hampshire patient is able to access the same care path. So from me, a massive well done to all of the team. And just to say, yeah, it would be really good to see about what happens with Shearwater. Obviously, I know we've got that capacity there, but just to, keep us updated. Thank you.
Thank you, we will do. I think that, the integrated working is really key. And last week we had the Chief Social Worker down for adult social care from Department of Health and Social Care with another colleague and showed her around the facilities at St Mary's, where we've got our hub, the discharge hub, the community assessment team, PRRT, the urgent community response team. And I was there as well, actually, last week, coincidentally. And it really helped us to focus on that integrated working, to keep it going, to keep it going through difficult circumstances sometimes, through all of the changes to the NHS that we've seen. And we've got the ambition to go further, so that we don't have the ping-pong back and forth that you sometimes get between health and social care for Portsmouth residents. We don't always succeed, but much of the time we can cut some of that out. So noted, and thank you. And we'll bring something back.
Yinka, did you have a...
Nothing from me. Thank you. Well done. Thank you.
Thanks, Yinka. I mean, I think this is as Andy said, it's a brief report, but it covers an awful lot. And as Lewis was alluding to, this happens one way or another every year, and there is and we never know what we're going to get, and we never know how it's going to be allocated, and everything like that. And as Andy says very clearly in the report, we then had, when the report was being drafted, that we then had yet another pot of funding that's come through, which has been done in a way which I agree with Lewis. I think if we didn't have the integration we have, we would probably have been spent very unwisely, because it was given directly to the ICB, and I remember myself and Andy having the conversation at the time, and he made the very valid point that the ICB don't commission beds, local authorities do. So without that sort of ready-made, and actually this is where I think the Shearwater contingency really came into its own, because in other parts of the ICB, in our Hampshire and Isle of Wight area, they're having to just go out to a few beds here, a few beds there, whereas we can just say it's one place, you're dealing with one provider, which is the council, and it just makes it a lot easier. And as we say, we're working through to see what extent of that we can or should do. But as Andy said, we've always got to keep the thing on the side that we can't be taking people on who are unfunded, and that, because that could leave us with a real problem going forward. So And this is absolutely the problem with that lack of foresight. I was on a call with Andy, and I actually hadn't realised they were on there, but Andy and David's, our deputy director, acting deputy director, were on a call last Thursday, and it was the LGA and looking at social care, the future of social care. And James Jameson was on there as leader of the LGA, and as he said at the National Adults and Children's Services Conference last year, I think someone said about a 10-year plan or something, or funding plan or whatever, and he said, as he always does, as he said at the NCAS conference, said then, well, it'd be just nice if we could get a 5-year funding package that we could actually plan for, because we all know that adult social care has the biggest budget on every upper tier council. We just would love to be able to plan forwards and know what we're going to get for years hence, rather than firefighting and a pot of money here, a pot of money there. And as Lewis said, if we do get a 2-year plan, that's a start. But we'll see. But no, it's I know the team does a great job. I think our discharge to assess model is a model that others should be looking at. And I think it's really a tribute again to all the work that everyone does together to try and make this work in what is very difficult circumstances. Because if we didn't have this locally, we know it would be much worse for our residents. I think in the end that's what it comes down to, and also supporting our partners, next door as well, because if we know we've got a good discharge pathway in Portsmouth, we know that can also support our neighbours elsewhere in the county who are also served by QA and all of that. So yeah, thanks for the report, Andy, and as I say, I think it's worth pointing out this is a work in progress and it never ends. And who knows, we might get another pot of funding next week that might be given to, the transport service, because who knows? It could be anything, couldn't it? Yinka, did you want to come back on the other report at all? The safeguarding one? Yeah, the first report, the safeguarding. If not, I'm sure you can have a chat to Alison. She'll be happy to. Yeah. So Alison's she's the safeguarding board manager, so you can come back to her. But I'm very happy to accept the discharge report, and as I say, I think it's just worth saying again is that we just need, as Lewis alluded to, as we've said generally, we just need. We wish we could have a proper plan, which is going to be for years hence, rather than firefighting every year. And I think that's the thing that governments have let us down with in the past. No matter what colour, they let us down at the moment, and if they don't sort it out, they're going to let us down in the future as well. So we need to be able to have some kind of planning, proper planning, for us to be able to do discharge as well as possible, but also plan for our social care system in more general terms. So that concludes the meeting. Thank you very much, everyone.